Thanks everyone for jumping on the call today. We're having a webinar with some really special guests who help lead the response for COVID at the federal level, and I'm excited to provide an opportunity for our partners with Colorado Business Roundtable to be briefed on what they're specifically doing in terms of work regarding COVID and economic recovery. So I'm Debbie Brown. I'm the president of Colorado Business Roundtable. We're a pro-business organization that helps amplify the voice of business and unapologetically talk about business as a force for good in Colorado's economy, because we know that we're all interconnected. When business thrives, it's not about buildings, it's certainly about people. And when business thrives, people certainly thrive. We work within what we call the ABCG. Our partners are everybody from academia, business, community, and government, and we convene and collaborate on issues that are important to the business sector. We work at the state level, the federal level, and the international level, and that's why this webinar is so important to a lot of our partners who definitely are interested in policies outside of Colorado and how it affects the business community. We've got a few things that we're working on that I'm happy to share with you outside of this call if you're interested, including a Faces of Business campaign that will highlight the important role that business plays throughout all four corners of Colorado. We're also working on recovery issues called a Road to Recovery initiative that we're going to be sharing and launching in December that really puts a 10-year look at how Colorado can best position ourselves for the highest and most sustainable economic recovery. And we've got a handful of pillars in respect in that area that the private sector, academia, and government have put together. So more on that soon. But for today's purposes, I want to go ahead and jump right in and introduce you to Dave Eddy, who will give a brief welcome on behalf of the COBRT Board of Directors and introduce our esteemed panelists today. So Dave Eddy is the chair of Colorado Business Roundtable, and his day job is actually he's the site director for Colorado for Boeing. He's passionate about workforce and education, and that's what brought him to the Colorado Business Roundtable. So welcome, Dave.
Thank you, Debbie. On behalf of COBRT and all our board members, I'd like to thank everybody for joining today. Looking forward to a very robust discussion and information sharing. We have a great set of panelists, and I'm just going to give you a little bit of insight for each one, and these are in completely random order. So first off is Susan Beckman. Susan is the Regional Administrator for U.S. Health and Human Services. She has an extensive background in government from city level to federal level, and she has been a councilwoman on the Littleton City Council, a commissioner on the Arapahoe County Board of Commissioners, a member of the Colorado House of Representatives, and in January of this year, Susan started her appointed position with the federal government as the Regional Administrator for U.S. Health and Human Services. Susan ensures that the department maintains close contact with the state, local, and tribal partners and addresses the needs of communities served throughout the HHS program and policies in the region. Next panel member is Sallie Clark. Sallie is the Colorado State Director, U.S. Department of Agriculture and Rural Development. She served as the County Commissioner in El Paso County for many years, in addition to serving on the Colorado Springs City Council. In 2017, she was appointed to her current position as the Director, U.S. Department of Agriculture and Rural Development. As a side note, she has been the co-owner of the charming Holden House 1902 Bed and Breakfast Inn for over 30 years, located in Colorado Springs. Sallie's focus is to oversee rural development programs in a customer-focused manner to restore prosperity in rural Colorado. Our third panelist is Angela Martinez. She's the Regional Director, Economic Development Administration. Angela has been with the U.S. Economic Development Administration for 11 years and appointed to the Regional Director in 2016. Previously, she was Vice President, Corporate Communications for the Motion Picture Association. Her organization, Economic Development Administration, is a bureau within the Department of Commerce, whose mission is to lead the federal economic development agenda by promoting innovation and competitiveness. Our fourth panel member is Evelyn Kim. She's the Regional Administrator, U.S. Department of Housing and Urban Development. Evelyn's diverse background brings experience from the Transportation Security Administration, the Department of Homeland Security, Executive Office of the President, U.S. Ambassador to the Republic of Finland, private business and education sectors, just to name a few. And in 2019, she started with the U.S. Department of Housing and Urban Development. Her role encompasses HUD's liaison to mayors, city managers, state and local officials, members of Congress, private and nonprofit developers, stakeholders, and customers in the Western region. And finally, last but certainly not least, Dan Nordberg. Dan is the Regional Administrator of the U.S. Small Business Administration. Dan's career experience includes serving as a Colorado State Representative out of Colorado Springs, and then to the U.S. Small Business Administration, where he oversees the delivery of the agency's small business programs and services in the region. Nordberg has previously worked in the private sector and also as a district director for U.S. Representative Doug Lamborn. In this capacity, he served as a liaison to Colorado's business community, as well as federal and state agency. So as you can see, our panelists are very experienced, and we're really looking forward to hearing from their particular sector exactly what's going on in the state's response to COVID-19. So with that, back to you, Debbie.
Thanks so much, Dave. Appreciate you being on with us today and being a part of introducing such an esteemed panel. And want to just kind of jump in. Appreciate all of you. We were talking before we jumped into the live section that, you know, if it would help you at all, I'd love to send you a crate of Red Bull and some vitamins, because I can't imagine what your workload must be like right now and what you signed up for, you know, and what you expected perhaps in January 2020 and what's been on your plate, especially in terms of COVID and economic recovery. You know, it's just been, I'm sure, just an incredible test of your leadership and your resources and your team and how you've been able to thrive in such difficult times. So I'm excited to get a briefing from each of you. And then I mentioned we'll open it up for some questions for our guests that are on viewing. If they have some specific questions, we'll open it up as well. So Susan, I'd love to start with you. We're going to pull up your slide if that works, and the rest of you can take a deep breath, and we'll get our first intro from Susan Beckman. And let me find that share screen for you, Susan. And go ahead and take yourself on mute and say hello, and I'll go ahead and pull up your slides.
Okay, well, thank you, Debbie and Dave, for the nice introduction. I did a PowerPoint presentation. I thought it would keep me on track for, I think, 5 to 7 minutes that we have, because I have a lot of information to share. There we go.
Okay.
Today, Debbie, I think you asked us to discuss the Health and Human Service emergency response to Region 8, specifically in Colorado, and the strategies and successes of, you know, what was happening on the ground, and then the opportunities that exist today. Next slide. It's important to note that during the COVID-19 epidemic, Health and Human Service was, for the most part, the lead agency. We were, of course, joined by our wonderful partners, FEMA, for much of the emergency. But the divisions that make up Health and Human Services are pretty massive. And on the local level, you think of human services as being child welfare and temporary aid to needy family and SNAP nutrition assistance, but really it's a very large organization at the federal level. You have CDC, FDA, National Institute of Health, CMS, the payer of a lot of medical bills for Medicaid and Medicare in Colorado, ASPR, our emergency response arm of HHS. It is a massive organization, and of course, the lead organization in the emergency realm for the largest public health emergency we've ever seen. In my role as the regional director in Region 8, I represent the administration here on the ground, and we work in regions. And I think it's really important to, next slide, to kind of show you the regions and how they are, you know, what states they are made up of. Region 8 is very rural and frontier. In fact, our most populated area is Colorado and Denver in the Front Range. But in Colorado, we have a ton of rural and even frontier hospitals and clinics and federally qualified health centers and doctors and dentist offices. And it makes responding to the emergency pretty a unique situation. It's important to remember that emergency responses, and it doesn't matter if it's a hurricane or an earthquake, the way we are set up with FEMA and our partners nationally, it's federally supported, state managed, and locally executed. So we worked with a lot of local governments in Colorado. Next slide. I wanted to show you some of the contrasts that we had with the rest of the nation. And I put up the numbers for the number of deaths, and every death was tragic. And we all know that COVID has really been very sad for our country. So I put up the deaths. These were probably reports that I got a few weeks ago. But I wanted to contrast that with New York City through this COVID emergency has had 23,823 deaths. And, you know, some states, like Minnesota has had 7,000. So just to understand that rural and frontier and less populated, and for a lot of other reasons, we had less impact of the number of deaths, which is good, even though all of our deaths are tragic and a tremendous loss. Next slide. So I want to talk a little bit about the response effort, because people don't really sometimes understand what was going on the ground. I stepped into this job in January, and the national public health emergency was declared on January 31st. So we have been very, very busy. One of the things that we do under HHS is a strategic stockpile. And that stockpile is used for medical equipment to be distributed for, like, if you have a hurricane or if you have an earthquake or a tornado. But in the public health emergency, I think we all understand that we are far too reliant on China for our PPE and medical equipment and medicine. And so at the tail end of a worldwide public health emergency and a national public health emergency, we have Region 8, and most of the private sectors were really strapped. They couldn't get the things that they had been able to order a couple of days before and get through almost an Amazon-like delivery system. The PPE spigot from the faucet was shut off. So during those days, in partnership with FEMA and private sector, we were able to deliver to Colorado 25.7 million N95 and surgical procedure masks, over 1.8 million eye and face shields, 5.7 isolation and surgical gowns, and almost 500,000 medical gloves. It's important to understand that that was happening across the nation. And, you know, we were real advocates for Colorado and our other states. Testing supplies, it's interesting to note that in our nation, the states and the cities and the counties and the public health departments and private sector all have different testing equipment. From Thermo Fisher to Hologic, they all use different types of test systems and equipment. And so when testing supplies from, you know, overseas stopped coming, it was very difficult to match swabs and media and reagents, all the things that local labs and hospital labs needed. So through with the working with FEMA, we distributed over 1.5 million swabs and 1.5 million doses of media, which, you know, I know that's in the weeds, but it's really important. Without these, no testing could be done. We've come such a long way with testing in Colorado and the nation. There are now point of care tests, and one of the first things that the federal government did was deliver 225 point of care tests to nursing homes, because we all know that in Colorado and across the nation, a significant majority of the deaths have been in long-term care and nursing homes. And so it was very important that we got them the best of the best testing as soon as possible. There has been a great breakthrough with Binex Now rapid point of care tests. They are being delivered. The administration is delivering them free of charge Colorado is going to get 1.7 million tests, with 100,000 of those tests shipped immediately, and they're like a rapid test, 97% accuracy, and they're kind of like a pregnancy test or a rapid strep test. And so this is a tremendous breakthrough. And through all of this, we have been also helping out with items, medical, and breakthrough COVID medicine like remdesivir. Gilead Science donated 181 cases for Colorado, and those were delivered through HHS of remdesivir, and to treat hospital patients, those that are on respirators and oxygen. And actually, remdesivir has been a great drug and has saved a lot of lives in Colorado. So we will go to the next slide. The CARES Act passed, as you know, during the epidemic. A lot of the hospitals, elective surgeries, and non-essential medical offices needed to shut down. And it was a very scary time for them. Their revenue just stopped. And in Colorado, just like the rest of the nation, you had hospitals and doctor's office and dentist office and all kinds of medical facilities really at risk. And the CARES Act passed in March 27, 2020, and Congress sent down 170 billion CARES Act dollars to give to revenue and grants for everything COVID related lost revenue. And in Colorado, we received 1.6 billion in COVID related allocations. They came very quickly. When the CARES Act was passed, it didn't really have directions. And so CMS and the administration worked very hard to make sure that it got out in an equitable and transparent way. It came out in tranches. First, it was last year's Medicare and Medicaid billing amount. The hospitals got that right away to keep their doors open. And then it went on to rural distribution, high impact distribution, skilled nursing facilities, and safety net hospitals and children's hospitals. So most of that money has been delivered, and I hear really good things when you talk to hospitals in these facilities. It really did help keep the doors open. Next slide. So I want to talk a little bit about the opportunities. COVID has been very hard in Colorado, but there's some unprecedented waivers and regulatory waivers that are really game changers on healthcare, and they're going to equip our healthcare system to have a lot more flexibility during the COVID pandemic and into the future. I love this slide. It's a slide that actually was provided by, next slide. Yeah, I love this slide, and you'll get a copy of this, but CMS has put this out, and it really tells a story of how much regulation waivers have happened since COVID-19. The administrative burdens for healthcare have been dramatically reduced to allow doctors to continue to provide healthcare. Telehealth, almost all the rules and regulations were waived during this time, and what we hear from providers across the state of Colorado is they like it. They like being able to provide healthcare from phone to phone, from office to phone, from computer to computer, and also to be reimbursed for those services. There probably was some telehealth happening before that wasn't reimbursed, but that has since changed. The science behind telehealth, especially in mental health, has been the effectiveness of it has been settled a long time ago. It's just the billing and payment methods had not followed. So that's very, very exciting. They also waived the provider payment from doctors and nurses that were licensed in another area, another state, could actually be paid through Medicare and Medicaid here in Colorado, which was a big change. So those are absolutely opportunities. I know they're working to see what of these waivers that we can keep, because reducing regulations, if they can be done in a safe way, can really help businesses survive and our healthcare system do a better job. Next slide. And so as we move into this month, the hope for COVID is a vaccine. And we know that we've taken a beating, and now we're kind of fighting back with this vaccine. We have 4 candidates in phase 3 clinical trials. It's interesting, I've learned a lot about clinical trials. The phase 3 or phase 1 of a clinical trial might be 30 people. To phase 2 is hundreds and hundreds. Phase 3 can be hundreds of thousands of people. So we have some candidates in phase 3, and it's really exciting. Technology, biomedicine has moved very quickly, and we're being able to benefit from that. But despite the efforts to develop a safe and effective vaccine, we're going to have limited supplies when the vaccine comes out. And so Region 8, North Dakota was chosen as a pilot project for vaccine distribution. And now we have 50 states that are working with CDC and the governor's appointees and Department of Defense, creating a distribution plan. If there are limited resources, where do the vaccines go first? And of course, focusing on the most vulnerable populations. So I think I will wrap it up there. Next slide. I hope we synced with our slides. There we go. I have some great links. There's been a lot of transparency. If you get onto these links, you can find out so much about how much money went to each state, and you'll find out a lot of information. So I wanted to add those to the presentation. And I'll turn it back over to Debbie. Thanks so much, and wait for questions after everyone does their presentations.
Great. Thank you so much, Susan. I know when we spoke a couple weeks ago, I was just astonished to learn all the scope that really is under your department. So really thank you to you and your team for all you're doing to try to help, as you said, provide a safe and accessible option for all Americans in this critical time. So thank you, Susan. We'll have some questions, I'm sure, for you at the end. Now I want to turn it over to Sallie Clark. Instead of stopping screen sharing, I just jumped in with your presentation, and welcome, Sallie, to the conversation. Thanks for joining us today.
Thank you very much, Debbie, and thank you for inviting me to the Business Roundtable. So most folks may or may not be familiar with rural development, and so I just wanted to provide a basic overview. We have been responding, as everyone has, to the pandemic, but our real, I think, focus is really not just response, but the recovery piece. And so I want to talk a little bit about our overall program. So next slide, please. So if you think of U.S. Department of Agriculture, everyone automatically says to themselves, oh, agriculture, but there's a lot of different pieces to what we do. Under rural development, I'm going to specifically talk about our role as one of the agencies that supports USDA in the 7 mission areas. Next slide. So essentially what we do is we provide affordable housing, we connect skill sets to jobs, we support local health care, and we modernize infrastructure. And that also includes high-speed internet access. As I like to say, it's easy to remember as ABC, and I'll go through the different what's A, what's B, and what's C, so you can remember too, because I have trouble remembering more than 3 things at a time. So next slide. So A really stands for affordable housing. Under our housing programs, we provide home loans for those that qualify in our rural areas. So we are a direct lender. So essentially, we're very much, we are the bank, and USDA is one of the largest banks in the world. You may not know that, but we have a lot of loans out there. For homeowners in rural areas, our direct loan program and our guaranteed, which would go through a bank, both of those programs require no down payment. Next slide. So we have the direct home loan program. We also have home repair loan and grant program, which can help those, if they're over 62, they may be eligible for our grants. And if they're not over 62, they still may be eligible for our 1% home repair loans, which is an incredible deal if they need to make really emergency repairs, if they need to put on a new roof or winterize or do things that are really life and safety oriented. That is extremely important. And then our guaranteed home loan program would go through a bank. So you very much like VA or FHA, you go to your bank and ask if you could qualify for a guaranteed home loan. Again, our home loan programs, neither one of them require any down payment. So, and that's for individual home ownership. Next slide. Then we have our multifamily housing program, and very similar, and I know Evelyn Lim is going to talk about HUD a little bit, but we have multifamily housing across the state. And we are able to provide, especially in rural areas, we're able to provide not only housing for individuals, but families in addition to the senior community. And we also have a farm labor housing component in our multifamily housing units. Next slide. Again, here's the different areas that we work with multifamily housing, and we also have a housing preservation and revitalization loan and grant program, which helps to bring maybe aging properties up to better standards. Next slide. Then the important one, obviously, for the folks who are listening today is the business and economic development component to what we do. We can fund technical assistance, we can do business startups and marketing and feasibility studies, in addition to providing guaranteed loans on businesses. Next slide. So under our business programs, we have our rural business development grants can help with providing assistance to create plans that help local communities. We also have intermediary relending programs where banks and nonprofits can basically be the pass-through, and they're able to relend money to local businesses who then can use those grants to boost economic development. Value-added producer grants are for actually agricultural producers that may want to expand their businesses, and they can get grant money to do feasibility studies to see if that's really going to work. And then finally, the Renewable Energy for America program, otherwise known as REAP, can help with solar energy, all kinds of energy efficiencies in businesses. And as an example, in Durango, the Sirius Texas Barbecue has solar panels on their roof. We've done quite a few different businesses that have taken advantage of this in rural areas to use grant loan combinations to be able to put solar panels and reduce their energy footprint. Next slide. And then additionally, we have the Rural Micro Entrepreneur Assistance Program. We have the Rural Economic Development Loan and Grant Programs. There's a lot. We have over 45 programs at USDA Rural Development, so I don't expect to go through them all today, but all we need to know is what you need, and then we'll see if we can find a program that fits your needs. Next slide. This is a little bit about the REAP program. We were very successful this last year on the Rural Energy for America program and helping both businesses and ranches and farms in energy efficiency projects. So all kinds of different types of renewable energy is a focus of REAP. Next slide. And then we also have cooperative programs. If co-ops want to start up, they can come together and assist with getting others to work together to really make their businesses more viable in a co-op environment. Next slide. And then telecommunications, obviously big thing right now. We're on a Zoom call. Telecommunications and infrastructure loans. We do broadband. Reconnect was one of our programs that's going on right now. We're just getting to, hopefully we'll have a couple of successful projects here in Colorado that USDA will fund. Community Connect is another one that actually application has just opened again. And then additionally, we do distance learning and telemedicine grants. So Small thing we did a few weeks ago is the Florence Library was able to get computers. We're able to provide telemedicine, where we can connect rural areas with urban areas on creating a better environment to be able to tap into those necessary resources for healthcare in rural communities where they won't be able to afford a doctor. Next slide. And then finally, community infrastructure. So that's what the C is for. And go to the next slide. This is actually the Trinidad Hospital in the background that actually Susan Beckman and I were down there last week to take a look at that. Our community facilities include grants and loans, primarily for health and safety, but we can work with just about anyone. We can work with an individual municipality, we can work with a county, we can work with a special district, and we can work with nonprofits on any of these projects. In addition to that, we have a small grant amount that we're given each year that up to $50,000 grants, similar to this ambulance right here, that would have been financed through one of our small community facility grants, and then the local body has to come up with a match. But it gives the ability for these small communities to tap into those additional grant resources. Next slide. And then under community facilities, importantly, we finance hospitals. We've done this year in Colorado, probably almost close to $80 million worth of hospital projects. We can do schools and daycare facilities, firehouses, police departments, community centers, and much more for either nonprofits or for local government bodies. Next slide. And then in addition to that, as I mentioned, the community facilities grants can be very helpful for local communities, very widely used for our program and extremely necessary for these small rural communities who qualify. Next slide. Then our water and environmental programs, clean water and wastewater is extremely important to provide to local communities. So this is a big part of what we do. They are generally loans combined with grants. So it's a very good program. And for local communities that really need to, no pun, tap into those resources, they are very low interest. I think right now our interest rate is below 2%. Next slide. So under that, our typical projects are listed here of the things that we can fund under our water and environmental programs. And next slide. Here are our office locations around the state. We have our Craig office in the upper left. Right here in Denver at the Federal Center where I am today is our main office, but then we also have an office in Delta, in Cortez, in Alamosa, in Bent County, which is the town of Los Animas, and then up in Ray, which is in Yuma County. So we're spread out all over. And right now we're all mainly working remotely, but we are definitely open for business. Last year, we were able to get out about $500 million to rural Colorado over our various programs. And if the next slide, I think, has my contact information, you can also go to our website at the rd.usda.gov/co. Follow us on Twitter. We announce projects and programs that are coming up on a regular basis, and let me know if you'd like to be added to our distribution list. And that's all I have right now about the ABCs of rural development. Thank you.
Great. Thank you so much, Sallie, for being on today, and appreciate all your feedback. I definitely didn't know that much about your agency, so really, really vital for Colorado, especially all four corners. Now I want to turn it over to Evelyn Lim with the U.S. Department of Housing and Urban Development for an update. And Evelyn, really interesting. I've just learned a lot more about opportunity zones recently, and I'm excited to hear about how your office is tackling some of the issues that are so prevalent today. So welcome, Evelyn.
Great. Thank you, Debbie. And thank you for inviting me to join you all today. I'll just spend a few minutes, and I apologize, I didn't put together a PowerPoint. My boss, Secretary Carson, was actually here yesterday, so I didn't have a lot of time to put anything on paper. So, but I just wanted to go through and outline some of the efforts that are being undertaken by HUD, obviously alongside our state local and tribal leaders as partners to provide relief to homeowners, renters, and those experiencing homelessness as they are affected by COVID-19 and the pandemic. And so many of you know that in March of 2020, Secretary Carson was added to the White House Coronavirus Task Force. As a world-renowned physician, he added great medical insight to the aspects of the task force, but also provided important context as the HUD secretary to some of the most vulnerable who are being affected by the COVID disease. And additionally, I had been part of President Bush's pandemic planning team back in 2006. We released our first pandemic strategy. And then in 2007, we released a pandemic strategy implementation plan. So as Dave mentioned, I have a background in Homeland Security and disaster response. So when Secretary Carson was added to the task force, they brought me to headquarters to support his efforts on the task force, as well as to lead HUD's response efforts regarding the pandemic. So today, and that's a role that I've played since March, only recently getting back to regional work here in Colorado. And Susan did a great job of showing you all the regions. My region is the same exact as Susan, so I cover the 6 states of Region 8, which is the Rocky Mountain region. Just getting back to that right now. But so today I just wanted to provide you some national level things that HUD has been doing to respond to the coronavirus, as well as some regional and Colorado perspectives. So very early on, our first concern was really to help keep people safe, ensure that our most vulnerable populations were getting what they needed. We also wanted to keep people in their homes and prevent any further dislocation and ensure those at the greatest risk of the virus, including the homelessness, were taken care of. The homeless were taken care of. So we knew that the homeless population were particularly vulnerable, and it was an urgent concern. The CARES Act, which was passed in late March, provided HUD with $12.4 billion additional funding to help communities that we serve, especially the senior citizens, homeless, and the disabled, and public health services. So just briefly, that 12.4 included $2.2 billion to our Public and Indian Housing Office, which provided support for tenant-based rental assistance, operating funds for our public housing authorities, and Native American grants. We also received $1 billion for our housing office, which allowed us to provide most of that to our project-based rental assistance and grants for elderly and disabled. And then our biggest pot was $9 billion for our Community and Planning Development Office. Our major programs under that are our Community Development Block Grants, CDBG, Emergency Solutions Grants, ESG, and our Housing of Persons with AIDS, HOPWA grants. And those grants go to our state and local entitlement communities. They're really pass-through grants that we provide them guidance in how to utilize those funds, but it's really up to the local communities to determine how they would best use that. So in less than a week after the president signed the CARES Act, HUD allocated $3.3 billion of that $12.4 billion directly through the CDBG, ESG, and HOPWA funding. So, and since that time, we've allocated all of our $12.4 billion through the CARES Act. In Colorado, that our major grants, which doesn't include all of the CARES Act funding, but again, the 3 CDBG, ESG, and HOPWA grants, that comes to $116 million that went to the state and local communities. So through all of that, we were helping communities respond quickly and providing maximum flexibility in utilizing their funds. Before the CARES Act was even signed, we provided what we called a mega waiver to allow flexibility for our grantees to utilize their CDBG funds that they already had. And then we continue to provide additional flexibility and regulatory waivers to our grantees so that they can access and utilize grants that best benefit their communities the most. Very early on, we worked with our partners at HHS, in particular the CDC, HRSA, and SAMHSA, and we developed tools and information for to provide guidance to our continuum of care homelessness service providers. So this included specific guidance for preparedness in shelters and encampment settings. So we knew that information about the virus would be important to get to these communities. And so HUD provided, from the CDC and other scientists, our homeless assistance providers, and especially our shelter providers, how to take measures to prevent and manage the spread of coronavirus in their communities, including coordinating with medical care for residents who are ill. So communicating was key for us in the very beginning as a hub for information to our stakeholders, which has also always been an important tenet of HUD's. We provided very early on in the early weeks of the pandemic, we did weekly office hour calls with hundreds of homeless service providers to answer their questions, to provide the latest guidance on best practices, and also provide them access to experts at the CDC and other HHS entities so that they can ask questions themselves of what to do with specific situations. For our housing, we, for both Section 8 and multifamily contract holders, and for our public housing authorities, in the early days, we wanted to ensure that all of our funding streams were fully obligated. During that time, we didn't know how long the pandemic would last, and we wanted to ensure that as we were transitioning to a virtual environment at HUD, that all of our grantees were still continuing to get funding from us. So we were able to do that. We continue to do that. The CARES Act provided, as I mentioned, additional funding through all of those offices. And so we were able to provide additional funding to our partners so that they could utilize funds to ensure that they had sanitary supplies, masks, gloves, all of that for their population, which the CARES Act provided for that. We also, this is a little bit old news, but I'll just cover it. So the CARES Act also established a 120-day moratorium on evictions for public housing and housing choice voucher programs. So that moratorium ended on July 24th. But during that time, our public housing authorities could not issue a notice to vacate or file a legal action to evict in the court for non-payment of rent. They could not charge fees for non-payment of rent, and they could not initiate evictions. So while that has that timeline has passed, we encourage our public housing authorities to work with their tenants during this time to ensure that that they're utilizing all of their HUD grant funding for rental assistance payments. And then additionally, as you may have heard, the CDC, using their expansive authorities, issued an order halting evictions for non-payment of rent through the end of the year for any rental properties. So in summary, the CARES Act provided additional funding, broad waiver authorities and flexibilities to allow HUD and our partners to continue to provide decent, safe, and affordable housing. For HUD's part, we're streamlining, expediting, in some cases waiving red tape to get funds working in the community right away. And then I also want to just talk a little bit about our what we're doing on our FHA side. So, you know, as I mentioned, we were transitioning to maximum telework. HUD continues to be on maximum telework throughout all of our 68 field offices. And so through that time, we wanted to ensure that we remained fully functional and that our FHA offices were continuing to make deals and close deals throughout the pandemic. So we've employed e-closings and other process changes to allow lenders and others who are involved in the transactions to work on deals, obviously safely and remotely as much as possible. We wanted to keep multifamily housing moving. As we all know, affordable housing is still a crisis. We anticipate it will continue to be a crisis when we get to the other side of this pandemic. And so we've continued to allow online closings, and we've expedited and streamlined a lot of our processes that had to be done in person. We've allowed them to be remote. And likewise, for single family borrowers under FHA, we wanted to keep transactions moving. So, you know, as I mentioned, we took immediate action for FHA for single family homeowners. March 18th, before the CARES Act was signed, we actually instituted a moratorium on foreclosures. That originally lasted 60 days. It's now been extended several times, but it's been extended until the end of the year. And so in addition to foreclosure moratorium, we've put forbearance options into play. And so, and we've put things in place that we normally do on a very localized situation where we deal with emergencies, perhaps in a hurricane, where we have localized forbearance options available. We've been able to do that nationally for all FHA single family homeowners. So servicers must offer forbearance if a borrower is experiencing financial hardship as a result of the COVID for up to 6 months to start. And then what happens is they can tack that on to the back of their mortgage without any penalty, although interest does continue to accrue. So in addition, we've done these partial claims, and then we've allowed you know, people, honestly, we're just trying to ensure that outside of every authority that we have under FHA, we're utilizing so that people can stay in their homes during this hardship. So the last thing that I will mention is just liquidity in the mortgage markets. Ginnie Mae is also part of HUD. And so we, through Ginnie Mae, have added our pass-through assistance program, which is an advance for single, multifamily, and reverse mortgages that are mortgage-backed security issuers. So the application of PTAP, which we've done again in emergency situations, but obviously very localized, which we are now doing nationally, it allows servicers to apply for assistance to pay for their principal and interest payments to investors who are holding mortgage-backed securities. So that applies to HUD, FHA, USDA, and VA loans. And just to be clear, this is a last resort option for Ginnie Mae, as this is all taxpayer dollars. We want to make sure that we're fulfilling our mission and being as responsible as possible with these funds. But it is a liquidity backstop, which is intended to minimize any disruption to the mortgage industry as all of these forbearance and loss mitigation programs are implemented nationally. So, so that is in sum what we've been working on at HUD. You know, we're just looking at all options and all of our authorities to ensure that we minimize disruptions to the mortgage industry, as well as ensure that the most vulnerable that we serve are able to stay in their homes and that we're protecting our homeless communities. So
great. Thank you so much, Evelyn. I appreciate all your you've got a lot on your plate, that's for sure. We're running a little bit late on time. I want to make sure all our panelists get a chance to talk, and we'll try to go over a little bit to have time for Q&A. If any of our panelists need to drop, we certainly understand. If there was a question directed to you, I'll make sure it gets to your office so that we're able to provide some follow-up afterwards, if that works okay. So next we've got Angela Martinez, Regional Director for U.S. Economic Development Administration. So welcome, Angela.
Hi, Debbie. Thanks to you and Dave, and thanks for hosting us today. I guess we all know the past 7 months have been challenging for all of us, as well as for communities that we work in and serve across the state. I will say that the reality that we're facing is forcing us to adjust our approaches to how we do economic development and also how we work. At my organization, the U.S. Economic Development Administration, we've had to adjust. In early March, we all moved to mandatory telework, as Evelyn noted, HUD has done as well. And we've all been working from home ever since. We have staff at EDA, like myself, who have school-aged kids at home or elderly parents that they have to care for while also working. And, you know, that's certainly an experience that many Colorado businesses are facing, trying to deal with continuing the important work that they do, as well as supporting their staff through the challenges of the pandemic. I know we are short on time, but just to tell you guys a little bit about EDA, our agency is the only agency that's a federal agency that's solely focused on economic development. We partner with economic development organizations and communities to help them realize their economic development visions and goals. Often, we're called on to help a community respond to change. That could be the restructuring of an industry, major job loss, natural disasters, or a pandemic, which never thought we'd have to do. I do want to point out to everyone up front that EDA does not directly provide grants to businesses, but don't stop listening to what I have to say. We work closely with local economic development officials, so units of local government, nonprofits, institutes of higher education, and we really support their bottom-up, regionally owned development strategies for stimulating their economy and creating jobs. You know, some communities really need help developing a plan and figuring out where to start. Others need critical infrastructure to support business expansion, and others need help building their innovation ecosystem to help create the jobs of tomorrow. And EDA can work across all of those areas. You know, I saw a headline not too long ago about the pandemic, and it talked about instead of focusing on bouncing back from the pandemic, we should focus on bouncing forward. And that phrase really stuck with me because that's what our agency has done over our 50-plus year history whenever a community faces an economic shock or downturn. So maybe it was a military base realignment, which we had here in Colorado with Fitzsimmons, which is now the Anschutz Medical Campus, and EDA made one of the first investments there to really help propel a new industry cluster in the state. Out in the South, it was furniture and textile industry restructuring, certainly the automobile industry restructuring, and as we know in Colorado, coal communities are facing a downturn right now. So we've worked across those industries and across those communities to help them focus on their assets and diversify their economies and bounce forward. So Congress has recognized that role, and over the past few years, they've given us dollars to invest on disaster recovery. And then, of course, in March, through passing the CARES Act, EDA received $1.5 billion to help communities prevent, prepare for, and respond to the coronavirus. So in our region, I represent the EDA Denver region that covers Colorado, but also 9 other states. So the map that Susan showed earlier is Region 8 and Region 7 combined is our 10-state region. And we received $197 million to invest in our 10 states. We certainly have seen a huge demand for those dollars. And we also recognize the need to get money into communities as quickly as possible. So we moved dollars into our economic development district partners, which we have several in Colorado who do regional planning, so they could support their counties with planning and response. And then we also have a revolving loan fund program, which your members may be interested in, and it helps fund a loan program that organizations regionally loan out to small businesses. So recognizing small businesses were really the first to be affected and continue to be affected, we are already moving dollars through loans into businesses right now through our CARES Act funding. And we're also in the process of considering applications for the remaining dollars. And I do expect that that will go pretty quickly. We have our demand is about 3 to 1. So, you know, the need is definitely there. You know, as I said earlier, we do have a very flexible suite of programs. So we can support a community wherever they are and what they need. So some of the things that we've seen come through to respond to the pandemic are manufacturing projects, maybe helping infrastructure for manufacturing, particularly for PPE manufacturing. Definitely the tourism industry. We all know Colorado thrives because of tourism and has been very hard hit by the pandemic. Of course, the revolving loan fund program, broadband projects, and other projects that are, maybe capitalizing on the opportunity zones, which you mentioned a little bit earlier. And I do think that the opportunity zone initiative can also be a big part of the recovery. And our department and Bureau has been working really closely with the White House Opportunity and Revitalization Council on focusing on delivering relief to communities affected by the pandemic. So we also have a tool that your members might be interested in, Debbie. It's an opportunity zone tool that's located at statsamerica.org/opportunity, and I can certainly send that to you. But it has a lot of data and information, demographic information on opportunity zones in the state and, of course, across the country that might be helpful to folks. So just to wrap up, EDA is a small agency. I like to say we punch above our weight class. And I know in the grand scheme of things, $1.5 billion, while to each of us is a lot of money in the federal government, it's not a huge amount. So we're really focusing on really strategic investments that are really going to support communities in being able to bounce forward and come out of the pandemic even stronger than before. So I know you have some questions popping up. I'm happy to address those after Dan wraps up. And if anyone needs to contact me, I'm at amartinez@eda.gov. And thank you again for having us and for hosting this discussion.
Great. Thank you so much, Angela. I'm new to your agency, so it's so interesting to see what you work on. And I think some of the folks, if you see a question that belongs to you, are just responding in the chat. And if it doesn't go to all the attendees, I'll make sure it gets to them after we speak. Dan, last but not least, and we're planning on, like, you've got all the time you need. I want you to have your full 10 minutes because it's such an important topic, especially what you do, Dan, with the U.S. Small Business Administration and how your agency has been a lifeline for the business community, and want to definitely hear what you've been working on, how 2020 has brought to light your role and your agency's role and how you've been helping business in light of COVID. So Dan, take it away.
No, great. Thanks, Debbie. Appreciate it. And thanks to Dave as well and all the board members of Colorado Business Roundtable. You guys always provide such good information and support the businesses need during these times. So thank you for that. For quick background, just on the Small Business Administration, for some context, our mission is to help small businesses start, grow, expand, and if necessary, recover. And unfortunately, with COVID-19, the focus has really been on the latter. And we've been having an intent focus on helping small businesses really mitigate the negative impacts from the COVID-19 virus. We are unfortunately seeing heightened challenges that many small businesses traditionally face, even worse than previous. And everything we're talking from securing financing, changing demand patterns, disruptions in the supply chain, and certainly an impact on the labor pool. It really has almost been a perfect storm against small business. So that being the case, our main focus the past 8 months, and certainly as we move forward, has been helping small businesses navigate those challenges and provide innovative solutions for them to move forward. And really the main avenue for SBA in doing that and providing that support has been through the administration of the Paycheck Protection Program. While it may seem like a lifetime ago, it was only 8 months on March 27th that the president signed into law the CARES Act. And this established the new $349 billion Paycheck Protection Program that was really designed to help employers retain their employees so that they could continue to serve their communities. Within 6 days of that bill being signed into law, the SBA had stood up that program and it went live. In the 13 days to follow, the SBA had approved over $340 billion in PPP loans, thus exhausting those first rounds of funds appropriated by Congress. And for context on that, I think it's important to note, the SBA did more loans in those 13 days than we had done in the past 13 years combined. So really an unprecedented and very tall task that our agency was faced with, and fortunately we were able to accomplish that mission. Then at the end of April, Congress passed a second round of funding for PPP to the tune of another $310 billion. And when the program expired eventually on August 8th, the SBA, a final tally had approved over $5 million loans valued at over $525 billion. 86% of those loans were under $150,000, and the overall average loan size was $101,000. So there's great confidence that despite some of the early hiccups, this really did go and serve its purpose and really provided a lifeline for those Main Street businesses, which it was really intended to serve. Of note to Colorado, here in our state, over 109,000 loans were processed, valued at close to $10.5 billion. So as you hear us all talking today about the CARES Act, I really don't think it can be understated how consequential that piece of legislation was. And I think what's also understated is that this was really a bipartisan piece of legislation. This was a byproduct of negotiations between the White House, the Congress, and really delivered a great success to the American people, not only in the form of Paycheck Protection Program, but also all the other programs that my colleagues have mentioned throughout the course of this webinar. One thing that I do want to emphasize, especially since the Colorado Business Roundtable is kind enough to host this webinar, is the incorporation of public and private partnership as it pertains to the Paycheck Protection Program. I can tell you almost certainly that there is no way that that program would have been implemented and have been done in the expedient fashion that it was had it not been for the involvement of private industry. And so as we move forward and we talk about collaboration and continued partnerships, I think it's going to be essential not only for the continued collaboration amongst our federal agencies represented here today, but also with the private sector and making sure that we are all working in tandem to get our economy back in order. So I know we're running low on time. That's a very quick overview on what our COVID-19 response has done, but appreciate the opportunity to share a little bit of what we're doing, and we welcome any questions that the audience might have.
Thank you, Dan. When you were talking a little bit about that, I was reminded of that line, you know, I'm here from the federal government, or here from the government, I'm here to help. Right. And probably a year ago, there might have been more of us who thought, oh my gosh, you know, we don't want to hear from the federal government. But all of you, I think today have really shown a light on how valuable these agencies are, particularly during these unprecedented times. And Dan, thanks for the shout out for private industry. I think, you know, government isn't the only one solution to how we're going to get out of this mess. And I like to think that any economic recovery, especially in the long term, is going to take the private sector's ability to innovate and be entrepreneurial, like we know we can be in America. So thanks everybody for the time today. I think we're a little bit out of time on questions, but what I'd love to do is kind of go through one more quick comment from each of you, maybe take 1 minute. We'll go back in the same order and just give any last words that you might have. It might be your website or what you're looking forward to in 2021. You know, it might be optimistic, it might be pessimistic, but, you know, kind of any last thing that you'd like our folks to know about the work that you're doing. And Susan, we'll start with you, kind of last remarks for the webinar today. And then I'm happy for everybody who left a comment in the chat section, I'm happy to get that follow-up done for you as well. But want to give some last words to our guests. Susan?
Thank you, Debbie, and thank you for the kind words. I know that my partners in Region 8 are all very proud of the work and feel that we really serve Colorado and have worked so hard to make sure that we get the resources that are needed to people at the right time, because this has been very trying during COVID. I have a lot of questions about telemedicine and the waivers, and I think it's important to, you know, these are one of the opportunities. Sometimes in a crisis like this, there are silver linings, and even though, you know, it's seems strange to call them a silver lining, but the breakthrough in telemedicine and the cleaning up of the regulations around healthcare is so very important. And for those of you that are very knowledgeable, I'm getting some really good questions here. It's important to be engaged. You have my email at the end of this report. Email me, and I can get you connected to regional administrators that are experts in their field that work in Region 8 and can actually, take that information up to headquarters in DC. But it's an honor and a privilege to serve the administration. And thank you, Debbie, for having us in this presentation.
Great. Thank you, Susan. Sallie, final remarks.
So again, I think as I said before, our focus is rural Colorado. I'm the state director just for Colorado. We have my counterparts in 47 states across the nation. So we're all appointees. And I just wanted to say that there's two programs, the Business and Industry CARES Act funding that we're getting, which is for working capital, that will go through September of 2021. So if you know businesses in rural areas who are struggling, they can come to us with, and they can go to their local bank and ask about the USDA CARES Act funding. Secondly, our agency is in the process, as I think Dan mentioned too, about cutting red tape. We have our One RD, which is One Rural Development Guaranteed Loan Initiative, which is cutting red tape and going to consolidate the environmental and economic development efforts across our programs through business and industry and through our water and wastewater and community facilities programs. That is coming out just now, so banks will be able to hopefully provide an easier process for folks who are looking for lending capacity. If you know what you need, just come to me, email me, get in touch with me at Rural Development, take a look at our website. Again, I don't expect for you to know 45 programs. I'm lucky if I can even remember the 45 programs. So just know that Rural Development is here to assist, whether you need housing, whether you need businesses, need funding or community facilities, and come to us, because there really is no one that we don't work with except big, large urban counties. So rural areas, just call on us and we'll see how we can help.
Great. Thank you, Sallie, so much. And I did remember your ABC, so that was a clever way to help us remember. Evelyn, 1 minute wrap up from you.
Sure. Well, I talked a lot about what we were doing for pandemic. I also just want to reiterate that the things that we normally do in the community, we're continuing to do them. I mentioned the secretary was here yesterday. We announced an expansion of a program that I think is really helping some of our most vulnerable people, and that's our Foster Youth to Independence initiative. And it's something that we just started. It took us 4 months to put together. And so when you talk about the speed of government, I think people think of that as a pejorative term, but really I think everybody should learn to expect more from their government, because we can really do things quickly if we have the incentive. And so yesterday, Secretary Carson announced the expansion of that program, both in funding and eligibility. And that really helps foster youth who are aging out of foster care, usually at age 18. It gives them housing, it gives them support services and resources they need to really become self-sufficient. So that is really exciting things that we continue to work on during pandemic. Another thing you mentioned was opportunity zones, and we'll get back to kind of highlighting what the communities are doing in that area. But from HUD's perspective for opportunity zones, our multifamily office has really doubled their production in this in the pandemic timeframe. So, you know, where we are continuing to support and ensure these programs, and we will continue to support affordable housing throughout the region.
Great.
So
thank you so much, Evelyn, and give our best to Secretary Carson. We'd love to host him sometime. That would be fun. Angela Martinez, a wrap up for our attendees.
Sure. Well, again, thank you so much for hosting us, and really just would like to share that EDA tries to work a bit like a consultant to communities. So I would encourage those of you who are on today to let the leaders of the communities where you operate know about our agency. And just remember, we create jobs and create private investment. So, and our programs are so flexible that there may be a way that we can work with that community to support the infrastructure or economic development needs that they have. So please check out our website. It's eda.gov. Feel free to reach out to me. I'll put my email in the chat. And again, just thank you so much for hosting us, and hopefully we can be of more assistance to more communities in Colorado over the next several months at least. Thank you.
Thank you so much. And before I reach out to Dan, I'll just say how wonderful that we have such high-level federal officials who are making themselves available and being transparent about their work and efficient and wanting to serve the citizens. I think it's actually really refreshing. So appreciate that you all are making yourselves available. Dan Nordberg, wrap us up.
Yeah, no, thank you again, Debbie, and everyone for participating today. I think I'll just leave on this note. You know, certainly with COVID, there's been some challenging times, and there's some level of uncertainty moving forward in the marketplace. No one can deny that. I also think it's really important to acknowledge how far we have come over the past 8 months, and really how much has been done to help and support small businesses during that time. And so we talked about the Paycheck Protection Program, the over $500 billion in loans that were sent out as lifelines to help small business during a very difficult time that was no fault of their own. And what's been really encouraging, especially as I've been out on the road and I've been traveling, is just seeing firsthand the resiliency and the innovation of private industry and these entrepreneurs, and learning to adapt to the circumstances that are beyond their control. And so private industry is continuing to do what they do best. They're finding new and innovative solutions, but there's also a recognition that additional support from Congress and from the federal government might be necessary. So I know for us at the SBA, we're all anxiously awaiting to see what Congress might do moving forward with respect to maybe another iteration of Paycheck Protection Program or some other kind of loan assistance that the SBA would be involved in administering. But in the interim here, I certainly want to offer my assistance and the support of our team in Colorado to any of the entrepreneurs or business owners listening to this webinar. If there's anything that we can do to be of assistance, certainly I highlighted the Paycheck Protection Program today. There's also a number of other traditional loan guarantee programs that SBA does administer to help small businesses. We also are involved in counseling and technical assistance. So whatever we can do to be of support, if we don't have the answer, we're going to put you in touch with who does. And that's really the role that we want to be facilitating right now. So thanks again for the opportunity to get our word out there, as well as all the great work that you guys are doing at the Colorado Business Roundtable.
Great. Thank you, Dan, so much. And Sallie and Evelyn and Susan and Angela for your time today. I know that you all have incredibly heavy loads and busy schedules. So we've taped this. We're going to make it available to our partners, as I said, in academia, business and community and government, and hopefully we'll be able to help build some bridges in that collaboration effort. I think I'd leave it like this. I actually am optimistic. I think, you know, for lots of good reasons, things have been put into place so quickly. Smart people across the country are figuring all the challenges out. And I'm looking into, I couldn't get through 2020 fast enough. I don't know about you all. We got to turn the page and have a really incredible 2021 in terms of solving the health issues, of course, and then letting the economy recharge. But appreciate all that you all have done to help in that effort. And I look forward to further collaboration. So thanks for being on today, and thanks for our attendees and our partners with Colorado Business Roundtable. And I look forward to seeing you all again soon, hopefully in person. Thanks, everyone.
Thanks, Debbie.